Hello, everyone. Welcome to another edition of Excuse Me, Doctor. We're here each and every week bringing you facts, figures, evidence, science, so that you and your family and your community can make the right decisions when it comes to your health and your health care. And we're here also debunking speculation and misinformation because we want to make sure that you have the facts and you have them straight. We're here every Monday night streaming on YouTube and Facebook. I want to welcome people who are new to the audience. If you haven't yet hit subscribe on YouTube, please do that. And if you're checking me out on Facebook, please make sure to hit like. So it is Martin Luther King week. We are celebrating him. And I just want to start off with a quote from Dr. Martin Luther King. He said, of all forms of inequalities, injustice in health is the most shocking and inhuman. That is a direct quote from the Associated Press article that covered him boycotting hospitals in Chicago because they were not offering or not providing equitable care and equitable access to care. They were discriminating against African Americans. He called for a boycott of hospitals that discriminated against African Americans, and he was successful. He used both direct nonviolent action and he brought lawsuits and advocated successfully for federal policy to defund hospitals that were in that practice. Now, the American Medical Association at the time made no comment. And of course, that's the association of, at the time, all white doctors across the United States. So here we are 54 years later after that quote. It was made before I was born. But we now have an African-American woman who has served as president of the American Medical Association, indeed demonstrating that arc of justice is long. And however, we are still dealing with healthcare inequality highlighted by COVID-19 and also the COVID-19 vaccine rollout, where lower income people and people of color seem to not be getting the same opportunities in some places across the country to get timely access to the COVID-19 vaccine. We're going to get into that in our show tonight, which is going to be all about vaccine facts too. And I'm going to be welcoming a little bit later on my two wonderful co-producers who are going to be asking me questions and helping me out with the weekly debunk. But first, we're going to start, as we always do, with the numbers and our weekly recap. So, where are we now as of January 18th? We're in the middle of January. We have 24 million cases of coronavirus that have happened in this country. And unfortunately, 400,000 deaths of people in the United States from COVID-19, projected to be at 500,000 by February. We're still having 2,800 to 4,000 people die every single day. And just in the month of December, we had 5,500 African Americans die. But, a lot of people take it when they hear that, Black people and brown people are disproportionately dying of COVID. They think, well, that means it's not a disease of white people. Well, no, 42,000 white people died in December alone in the United States. So this disease, it favors no one. Now, the good news is that we've had 14.2 million people who've recovered. And even though the vaccine rollout is not proceeding on schedule, we still have had 12.3 million people who've been vaccinated against COVID-19. So those are the numbers. And we have some more news to recap, starting with the fact that I'm just going to say I feel a little bit vindicated by this first item because last summer on a Pacifica radio station show that I was a guest on, there was another guest who was a pediatrician up in New York, and we kind of got into a little bit of a on-air argument about whether children can transmit COVID. And she was basing her data off of old studies that had been done at the beginning of the pandemic when children were on lockdown and schools weren't happening, and it seemed like children really did not transmit COVID-19. But it didn't make sense to me that they didn't, and there had been newer data that I was referencing that showed that they did. Well, there's been a huge study that came out of India. It was done with India and the United States, looking at 500 million, sorry, 500,000 people, 500,000 people. And they showed that children, especially and young adults, especially in households, have a disproportionate role in transmitting coronavirus. And some of you probably already figured that out in your own households, that it was maybe your children who had play dates, or your young adults who, were working as frontline workers or socializing with their friends, that may have been the ones to introduce coronavirus into your household. So it's not surprising that this study has come out, but it totally debunks all that early research that kind of suggested, oh, children don't really transmit the virus. Now, the next thing is, you got to ask for it. What am I talking about? Well, that monoclonal antibody treatment, Regeneron, that the president and his friends had access to, well, it turns out that it is not being prescribed to the regular public as it should be. There's collections of it sitting on the shelf. The reason why is because doctors sometimes don't know the procedure to go through to get it. It has to be infused in an outpatient infusion center. And let's take a step back. The purpose of these monoclonal antibodies are to give them to people when they are first diagnosed with COVID, in an effort to keep them out the hospital. So they're for people with mild COVID. So some people have been saying, well, even though I have risk factors or I'm over 65, I feel fine, so I'm not going to take it. But then a week later, they're sick and they end up in the hospital, or the doctors don't know to look for an infusion center nearby where their patients can get the antibody. Bottom line, if you are in a high risk group, meaning you're over 65 or you have a chronic condition and you get COVID, ask your doctor to prescribe the antibodies for you. And there's a website where you can actually put in your address and find an infusion center near to you. It takes about 3 hours for the full infusion. But if it's something that's going to keep you out of the hospital and you're in one of those high risk groups, I say go for it. Now, the next thing is long COVID. Does everybody know what long COVID is? It just basically means that you've had COVID and you have persistent symptoms. It shows, data is showing that 1 in 10 people who catch coronavirus go on to suffer longer term consequences than just the 2 weeks or 1 week where, most people have symptoms. They can extend for 3 months, 6 months with chest pain and shortness of breath and brain fog and a host of symptoms. And it turns out that they're getting problems like heart disease, liver disease, kidney disease, and diabetes. And unfortunately, this study out of the UK that just got published today shows that almost 1 in 3 people who recovered from COVID, who were hospitalized, returned to the hospital within 5 months, and about 12% of them end up dying. And they're not being captured in the death statistics for COVID, because that's typically people, within 28 days of diagnosis. So these people are unfortunately dying much later, 5-6 months later, and they've had complications from COVID that have lasted that long. Again, yet another reason to mask, socially distance, wash your hands, avoid crowds, stay at home, because you don't want to get this thing. And then the good news is there are 2 new medications for people who are hospitalized with COVID. So we know about steroids, dexamethasone, that addresses that overactive immune system that happens when you get COVID, and is the thing that ends up, unfortunately, causing people to die and get really, really sick. So steroids are great, but these two other medicines also address that overinflammation, but they specifically target the protein in your body that revs up your immune system into overdrive. So they're even more specific. Tocilizumab and sarilumab are the two medications. You don't need to remember the names, but just know that there are more options now to treat people who are hospitalized with COVID. So now that's our weekly recap. I'm going to bring on my two wonderful co-producers, Mr. Wayne Bruce and Ms. Lila Mays from the West Coast. And so happy to have them back with me this week. They're going to take me into the weekly debunk and then to the show where we're just going to go into those vaccine facts that everybody is asking about.
Wow.
Hello.
Hello.
Hi.
Can you hear me?
Welcome.
Yes.
I can hear you fine.
You can hear me fine. Okay, good.
Yep.
That's a great thing.
Yes.
How are you, Dr. Mel?
I am doing great. How are y'all doing?
Good. Good, good, good. Since we can hear you so clearly, Wayne, you want to start us off?
Well, I'm going to start. Normally we generally do the weekly debunk on cartoon, but the past 2 weeks we haven't. So we're going to have to do the weekly debunk live again. So it goes like this. The weekly debunk, stopping misinformation in its tracks. And then it goes to Lila.
The vaccine will cause you to get an autoimmune disease like arthritis, lupus, or sarcoid. Dr. Bell, is that true?
No. So there was this nurse practitioner who came out with this video that got shared a bunch of times, and she wanted people to believe that because when you get the vaccine, your body makes parts of the virus, right, in order for your immune system to react to it.
Mm-hmm.
She was trying to say that because your body is making something, right, that when the body attacks it, it's going to cause an autoimmune disease to happen because the body is attacking something that it made. Okay. I even have a hard time explaining her logic because it's so far off base. First of all, when any virus invades your body, it gives your cells the instructions to make more of itself, and your cells do that. That's what an infection is. So in a normal virus infection, which we have all had, colds, hepatitis, flu, viral diarrhea, otherwise known as food poisoning, we've all had this happen in our bodies, and it has not caused an autoimmune response. So therefore, it's just sort of ludicrous to suggest that because you're getting it by way of a vaccine, it's the same mRNA that the virus introduces into your body when the virus invades your body. And then, the childhood vaccines that we get, measles, mumps, and rubella, that's a weakened vaccine. So you're getting weakened versions of those viruses. Same thing. When it gets into your system, it gives instructions to your cells to make more of it. It's just that it's weakened version, so it doesn't, ramp up like the real virus would. So again, our bodies have been through this a trillion times. The vaccine is just mimicking the natural way that our bodies form antibodies, and that's why it's effective.
Okay. In my debunk question, I avoided mRNA because I didn't I wasn't sure.
No,
So
that's
thank you,
okay.
Dr. Mel, for saying what virus we were speaking about.
Right.
Yeah, yeah.
So my question is, uh, where are people getting this information, this misinformation, I should say first, because it's not real information.
So, misinformation is always based on a grain of truth, a half truth, a 3/4 truth. There's some truth up in there. And that's why people, people recognize the truth but they don't recognize the lie that's built on top of it. So, for example, with this video with this nurse practitioner, there is mRNA in the vaccine.
Mm-hmm.
The mRNA is introduced into your body via the vaccine. Your cells do make more virus based upon that messenger RNA. The lie is that your immune system, that this reaction, like I said, I can't even repeat her logic because it's so far off. But the lie is that it causes autoimmune disease, because it doesn't.
Okay. So it's a hint of truth in every lie. It makes it good, huh?
In every misinformation
In
In
or
every
disinformation. Yeah.
disinformation. Okay, I'm too blunt.
As opposed to a lie sometimes is just a lie. But
It's just
misinformation has a grain of truth in it.
so look, our first show of the year was so popular, and it was
Mhm.
all about the vaccine, right? We debunked everything, and so we decided, we talked amongst ourselves as we do, and decided we would come up with this show. Uh, and because in the past week, I have tried to talk close friends into really getting information, real information for themselves. I mean, I have a few close friends who have been through various diseases, very serious diseases, such as cancer, and I mean, just they're really at risk, and they're still on the fence with this.
Yeah. And people, especially who've had health conditions, should be careful about their health. They should question everything. There's absolutely nothing wrong with that. But it's important to go get the facts about the vaccine. So there were people with pre-existing conditions like cancer, sickle cell, diabetes, high blood pressure, who were included in these studies. And it showed that the vaccine, was 94 to 95% effective in protecting them against getting COVID-19. Compare that to people who have not been vaccinated, which is what's been happening over the past 9 months, and the death rates for people with these same conditions with COVID-19. That's why specialty societies like the American Cancer Society, the American Diabetes Association, the Sickle Cell Association of America are advising people, their members who have these diseases, to get vaccinated, because the
Mhm.
risk of getting COVID far outweighs
Yes.
whatever the risk of the vaccine is.
And I think that's really important. And I think, we can take this moment to just stress, we've said it in the past, we are not telling people to go and get the vaccine. What we want to do is encourage and invite everyone to get as much information about
Right.
the vaccine as possible. Talk to your healthcare providers, and also take into consideration that as Black people, we are disproportionately affected and killed by this virus.
Yeah.
So we got to get the facts. So Dr. Mel, in terms of the vaccine, I think it's important for us to talk about the rollout. And we really did one of our conversations was about the fact that we are disproportionately affected by the virus, but also not getting the vaccine at the rate that we could be getting the vaccine in terms of, its rollout. So can we just cover the kinds of vaccines there are, the dosages really, really quickly, Doc, and then talk about the
Yeah.
rollout phases?
Yeah, sure. So there is the Pfizer vaccine that got approved first, and then the Moderna vaccine that got approved second. Both of them use the same kind of technology, which is the messenger RNA that we talked about, which is giving your cells instructions on how to make a little piece of the virus that your body can then mount an immune response to. Two main differences with, actually three main differences with Pfizer and Moderna. Pfizer requires that deep refrigeration, so it mainly can only be given out of hospitals. It was approved for 16-year-olds and over, whereas the Moderna was approved for 18 and over. And also the difference is in time in the dosing schedule. The Pfizer vaccine is given at, both doses are given 3 weeks apart, whereas the Moderna, which also requires 2 doses, is 4 weeks apart. We have some other vaccines that are coming down the pike. AstraZeneca is probably going to be one of the next ones. That's also a 2-dose regimen. And Johnson & Johnson, which could be a game changer, is also next up, probably in February. And it's going to only be 1 dose, which is key.
And then, Dr. Mel, can any of these vaccines be combined? Should they be?
Yeah, that whole thing came up because they were talking about, if they ran out of one vaccine, could you give the other vaccine as a second dose? And
Mhm.
no, 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 that's not a good idea. That's not how they were studied. And you don't want to deviate from how they were studied because that's what they were approved to be given in a certain way.
Okay.
So you need 2 doses of Pfizer if you started off with Pfizer. You need 2 doses of Moderna if you started off with Moderna.
Because our grandma and them, Pookie now, they be like, I'm gonna get as much as I can when they decide to take it. I want everything. I want to combat it as strongly as possible.
Yeah, yeah,
Don't
no,
do
that's not a good idea. Not a good idea.
that.
But
Okay.
speaking
Okay.
of people being greedy, there are people jumping the vaccine line.
I was gonna get to that. Yes. Where? Go ahead, Wayne. We can't hear you, sir.
My mic was muted, and I
There we
Oh,
go.
muted it
okay.
because
There
I
you
didn't
go.
want to breathe during that. But yeah, we want to get to that. That's part of the things that Dr. King was talking about, just
Yes.
having access to
Mhm.
healthcare. And we, in our producers meeting, we shockingly, the producers found out some shocking information over the weekend,
We did.
and about social determinants of health. Now, you've talked about this on a previous show with the congressman from Minnesota,
Yes.
Lila Jeff.
Jeff
What's Jeff?
Hayden.
Mr.
Jeff
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 Hayden.
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 Jeff
Yep.
Hayden, because I need you to finish the last part of that word for me. So Jeff Hayden, shout out to Jeff Hayden, who came on and did an incredible job around the time that George Floyd passed. Mr. Floyd was murdered. I can say that. You can't say that, Doc. But talk about just that, jumping the line in the social determinants of health and actually what causes that.
So, social determinants of health. First of all, yeah, let me say I had a wonderful conversation with Congressman Hayden, who represented the district in which George Floyd was murdered. And yes, I can say that.
Yes.
Social determinants of health are the social factors that determine our health, just like they sound. How healthy you are is determined not by the amount of time you spend in the doctor's office, although that's important. 80% of how healthy you are is determined by stuff that happens outside the doctor's office. Do you have access to healthy food? Do you have access to health insurance? Do you have access to transportation? How well educated are you? Are you employed? All these things impact how healthy you are. Do you live in a neighborhood where there's violence, where there's healthy food options, or where there's a liquor store on every corner? All these kinds of things impact how healthy we are. So, one of the things with this vaccine rollout is in some rural areas in Mississippi and in some areas in cities where there's a black population concentrated in one area of the city, they were seeing that there was not enough access to vaccines. So the system that the state or the local authority had set up to distribute vaccines,
Mm-hmm.
people who were wealthier were able to get on their computer and make the appointment, or talk to a hospital CEO and maybe get the access to the vaccine by making a contribution to the hospital. So all these things are going on sort of behind the scenes and under the table. And meanwhile, Black and brown communities are not getting access to the vaccine at the same rate. That's a problem. And we have to
Well,
call that out.
Well, well, I'm glad you did, but some of the same things happen near to where I live. I mean, I'm from Washington D.C., and some of those same things happen. I don't think they were meant. I don't think they were, intentional in Washington D.C. But we forget we live in such a digital age that we
Mhm.
forget that some people don't have access to basic internet, to a
Yes.
computer.
And
To
you're absolutely right. And there was actually a article in the Washington Post that called out the way that the system that was set up, which was you had to go online and make an appointment. So if you have leisure time, you could sit around at 8 a.m. on a Saturday morning by your computer to make an appointment if you want to get the vaccine. But this was a rollout that was for seniors over 65. So some seniors don't have access to a computer or not internet literate to be able to do that. And then the phone line wasn't staffed with enough people so that there was an alternative for you to pick up the phone. You couldn't really get through to anybody. Now, thank goodness they were very responsive. The city was very responsive. And what they did, thankfully, was set up a system by which certain zip codes where they know there are underrepresented or vulnerable populations, like Black and Brown people that live disproportionately, they set aside appointments specifically for those, for that population of people that live in those wards, those sections of the city. But prior to that, in the lines to get vaccinated in a city that's 47% Black, 80% of the people in line were whites. So we're moving now to getting that rectified in Washington, D.C. So it's
I don't,
more equitable.
I don't understand how that happens. Like, I mean, I do understand privilege, but that just infuriates me. And I told you, Dr. Mill, and I told my co-producer Wayne, one of the stories coming out of Los Angeles, California, is that people with wealth are just buying the vaccine, using their influence and their money to go to hospital administrators and get access to the vaccine, which is just so
It's
out of pocket.
it's
And
really it's disgusting.
it is.
Um, Now, what's happening at hospitals, though, is that some of the hospital workers are refusing the vaccine because of, misinformation or concerns about getting the vaccine, and so there is vaccine going to waste.
Right.
But there are more equitable ways of distributing that vaccine other than it going to the highest bidder.
So if we have all these, we had millions, right? I don't know how many doses initially,
It
but
was
a lot.
supposed to be 20 million by January 1st.
And as of today, the rollout is only at, it's not even at 50%, right?
No, no, no. It's at 12 million. But remember, we were supposed to get 20 million by January 1st. We were only at about 4 or 5 million by January 1st. Since then, we're now at 12 million. And then President Biden has, and I know I'm jumping the gun, but President Biden has said that
Two more days.
we're going to get 100 million doses distributed in the first, or in arms, in the first 100 days. And he has an aggressive plan to do that. I don't know if he's going to be successful, but that's the goal.
So we just had a comment come in, and it's from one of our great supporters, Valerie Spalding Parker.
Hi,
And
Valerie.
hi, Valerie.
Hi,
How
Valerie.
are you? And she said, when I called on the phone in DC to inquire about the vaccine, the exact time the vaccine was released, there were 275 people ahead of me on the
Huh.
phone. It can get
Yeah.
frustrating.
Yes, absolutely. And I think you had the same experience, right, Wayne? When you were trying to set something up for your dad, you were 180th.
I was 180th. I had better luck than Valerie.
Yeah.
So
Wow.
Yeah.
and we find, I'm reading that we find the World Health Organization, the head of the World Health Organization has called it a catastrophic moral failure for
Yeah.
vaccine distribution worldwide, though.
Yeah.
And countries need to come up with a more equitable way of vaccine distribution.
So that's the international version of what we're talking about on a domestic version, right?
Right.
Is that
Right.
the rich countries have, gotten with the vaccine manufacturers and disproportionately grabbed up all the available doses of the vaccine in poorer countries. I think they said something like 25 vaccines have been given in poor countries in that article. It
Actually,
was
25, the number
yes,
25.
the number 25. Yeah.
Okay. So here's where our conspiracy theorists come in because I heard I heard that Bill Gates is purchasing vaccine for everyone.
Right.
So okay, this is why.
That
Because
is
there's a
why. Yeah, and it's not because of some kind of nefarious thing that he's trying to eliminate, people from poor countries and cause population control. It's that he knew that rich governments were going to grab up the vaccine for themselves, and so his foundation, which does charitable things, he allocated money for doses of vaccine that will go to less well resourced countries,
Hmm.
so
specifically to make it equitable.
so I want to go to Lila. Lila, LA is still on fire. LA is still burning, unfortunately. And you live in Los Angeles. Los Angeles is
Hmm.
still on fire. Give us an update. You sent an article to us today. Give us an update on what's going on there.
Oh my gosh.
Yeah.
So, yeah, in Los Angeles, people are dying from coronavirus every 6 minutes. The article that Wayne is mentioning is about um, health officials removing adjusting air quality bands because of crematoriums because there's so many bodies in the morgue. They have to figure out how to manage these dead bodies. And so the health officials are talking about a lift on air quality controls, their air quality controls in place for crematoriums. Um, but what is really, really heartbreaking to me is with that data, it's in your face, in my face, every single day on every news outlet. There is radio, television, people are dying every 6 minutes. Yet anytime I have to go and take care of business, go to the grocery store or um, take care of business for my aunt who's in assisted living, I see people in the streets like it's nothing going on. Gatherings every single day, malls open, restaurants aren't open, but the lines for picking up food are down the street. I mean, and what is crazy to me is it's so rampant in communities of color. I live in a community of mostly black people, a lot of black people, and y'all in the streets, food trucking, barbecuing, partying, drum circling every day.
That sounds very
We,
LA. I'm sorry, the drum circling. But
it the
you're
drum
I mean
circle is funny, but it's heartbreaking.
yeah, exactly. I mean, I try to inject a little bit of humor in there, but my heart is breaking just to hear you talk. Um it's one, if you take a group of 750, either you choose indigenous people, black people, Hispanic people, one there's been at least one COVID death in that group of people.
Right,
and
right.
and a few months ago it was 1 in 1,000, then it became 1 in 800, now we're at 1 in 750, and that death toll is just, it's rising. It's rising, like you said, one person every 6 minutes in LA, or no, in the
In
country,
LA,
in LA,
in Los Angeles, in
in
Los
Los
Angeles.
Angeles is dying, and there is a disconnect. I mean, there's COVID fatigue, we know. There's people that just don't process, I think, that what their actions are doing. There's not a clear understanding of what asymptomatic spread is, that I can feel fine, but I can give it to my homies, or I can give it to my grandmother, or I can give it to my brother, and I have no symptoms whatsoever. I could feel fine. And because our communities are so tight knit and we're so close to our families, in times of trouble and challenges, the natural instinct is to bond together and to not separate. But that very instinct that has kept us alive and resilient all this long is our Achilles heel right now,
Yeah,
because we feel like we can still get together with our sister's household is separate from ours, or our cousin's household, or have that extended, family get together. And it's literally the fire that is fueling this pandemic to do that. I don't know what else to say to try to help folks make that connection that their behaviors and what they're doing is fueling this. And sometimes it's not their fault. You know, we are predominantly the frontline workers that have to be out there and being exposed at work.
Mhm.
But a lot of us sometimes too are doing it because we just want to be with our family and we just want to live our best life.
And
Oh,
I think that's a part of it. Hang on, wait. I want to just go back to the social determinants because I think that one of the things we discussed over the weekend in terms of social determinants and your health literacy and just literacy or being
Mhm.
illiterate, period, completely contributes to that, right? And
Mhm.
so Dr. Mel, I would ask that you would go through the phases of the vaccine rollout at some point. I don't want to jump ahead of you, Wayne, if you were going to get to that. But I think this show is so important because for people who are challenged in their health literacy and their literacy period, we're speaking it to you to make it plain, right? We're giving the information so you don't have to read the pamphlet. If you speak a second language, if English is your second language and you don't read your native tongue necessarily as well as you could, this information we're giving to you, you can hear it and apply it without having to dig for it yourself. I just wanted to put that into the space.
Yeah, no, thank you, Lila. And you know, I wrote the book Excuse Me, Doctor, specifically to put things in plain language so people can understand how to navigate the health system better and understand about their health. And then I actually got a grant from a local foundation to take the book and turn it into a verbal
Hmm.
course so that we could work with people of different health literacy to be able to understand. And, you know, literacy, you know, understanding how to read and your numbers is, you know, we assume that everybody can do it. But there was a study in DC that showed that 17% of people who came through the emergency department did not have functional literacy.
Right.
And so you take those people and then you multiply it by even more people who might be able to read and write, but their health literacy, their ability to understand medical language and read nutrition labels and understand discharge instructions from the hospital is also impaired. So, so having things in movie form and cartoon form and audio is so important to be able to get the message out. But yeah, it's important to close that gap. Health literacy is one of those social determinants of health. The other thing that I didn't mention, I talked about people being frontline workers, but also people who are living in crowded living situations. It's
Sure.
hard if one person gets COVID to isolate from everybody else in the household. And so I saw some, advice that I want to share on that. Open the windows, use a fan and have it blowing out of the house. Use separate forks and knives and utensils. Wear a mask at home, even if you're in a crowded living situation, to try to cut down on the spread within your family.
wow. That's excellent. I would like to go take some questions from our listeners and viewers. And I take a couple things. Beans Morel. Hey, Beans. That's my cousin there from Philly. She says, I scheduled my mom's vaccine today and the process was seamless. I'm in Philadelphia and my mom is in California. So that's good to hear. Um,
Yes.
Marv West from the Midwest. Are the people in the Black community just mentioned wearing masks, Lila?
Nope. No, sir.
No masks,
Very,
no masks at all, or they're wearing them improperly.
very few. And then when they do have them on, they're wearing them. And these gatherings that I'm speaking of, very few people are uh, wearing masks.
Ah,
Even fewer
ah,
wear them properly. I mean,
And and
I've sent you pictures.
and
yeah.
where you live, is there a mask mandate or no?
There's absolutely a mask mandate in Los Angeles. Yes, yes.
They
I'm not
don't
Okay.
supposed to
care.
walk. I'm not supposed to walk out my door without putting my mask on.
Actually, in Washington D.C., you're not supposed to leave your house without a mask on either.
Yeah.
Do people do it? And I sent you earlier a study that said we might need to wear our mask even while riding our bikes and
Yes, and
walking
jogging.
and
Yes.
jogging.
Yeah.
And
Yeah.
that's the thing that upsets me the most about a lot of joggers. And I don't like going to the park when it's crowded. I don't like walking when it's crowded. And I get upset when I'm walking when people walk by me with no mask because you care
Yeah.
about yourself. You don't care about me.
Yeah. So, there was that whole thing early on that, masks will suffocate you. And so you shouldn't exercise with them. N95 masks, yeah, because there's such a tight seal, is difficult to exercise. But with regular surgical masks or cloth masks, it does not cut down on your oxygen available to you when you exercise. And so, there's some scientists that say, when you are exercising, you're breathing, you're exhaling more forcefully and more often. And that's actually the time, even when you're just passing somebody transiently, or if you are running behind somebody that you might be going in the same direction, you're actually maybe getting exposed to the virus. And with this more aggressive, more infectious strain that's going around, they're saying that, it's 30 to 60% more infectious than the previous strain. And in a couple months, it's going to probably take over. We have to also be cognizant about that. So I would really encourage people to wear their masks outside, even when they are exercising.
Okay, we have another question coming from, I want to get this in. Alpha Johnson. Hi, everyone. I'm wondering if it is recommended that we wait for a period of time after the vaccine is available to determine if the population is having any adverse reactions.
Very,
Hi,
very popular question.
Yeah,
Yeah.
hi, Alfia. A lot of people have taken that wait and see posture.
Yes.
And, this is the thing. The vaccine was studied for 2 months before it got approval. And there's been additional month and a half, month now of data. And as far as we can tell, the vaccine reactions have been predictable. Okay. And most vaccine reactions, if not all, occur in the first couple months. So that's an allergic reactions, right? And inflammation type reactions that affect the nervous system. So Bell's palsy is one of them, transverse myelitis, which is inflammation of the spinal cord. What we've seen with this vaccine is that there are no additional cases of Bell's palsy or transverse myelitis than would occur in the any random population that you would observe. So but what's called background frequency, the same frequency that you see just on any regular day without the vaccine is the same rate that is happening. So it doesn't appear that the vaccine is causing new cases of these things. The vaccine is associated with, some local arm pain at the time. You might have a day or two of body aches or headache. I had a little bit of a headache. I took Tylenol. I felt fine afterwards. But there are those side effects which are expected. It means that your immune system is ramping up. And then for the allergic reaction, they say don't take it if you've had a reaction to any components of the vaccine, which are published. You can find them anywhere on the internet now. So there's really no utility in waiting because, a lot of all the expected things have already been observed.
So Dr. Mill, if I get the vaccine, both doses, then is it safe for me to travel, like to go visit my mom who may not have had the vaccine?
Yes, but you still need to mask and social distance, and take all the precautions that you took before you were vaccinated, because the vaccine only protects you from getting sick. It doesn't
Okay.
protect you from passing it on to other people. So if you're going to see your mom and your mom hasn't been vaccinated, you're going to still have to stay 6 feet away, not be in the same room with her, ideally wear a mask, etc. See her outside as opposed to inside. until she gets vaccinated. Now, when she gets vaccinated, then, you can resume, being close, etc.
I mean, she'll be vaccinated first, but
Yeah.
I just,
Yes, she
yeah.
should. So we have another question, or maybe it's a comment. I didn't read it before, and I'm sorry. I'm just trusting that our longtime listener, Ellen Claire Lamb, says this. Four members of Congress tested positive for COVID after being shut in a room with idiot colleagues who refused to wear masks. But a lot of the members of Congress would have gotten at least one vaccine shot before January 6th. Can you still test positive or catch COVID after a single vaccination? Would the first shot at least decrease the virus severity?
Oh, good question.
Excellent question, Ellen Claire Lamb. Hi, Claire. So, yes, a lot of them may have been vaccinated, but the thing is, you don't really get a immune response that's effective against the virus until 2 weeks after you get vaccinated. And at that point, it's only about 50% effective in protecting you from COVID-19. Once you get the second dose, that's when you get the levels of 94, 95%. And again, that's 2 weeks after the second shot. So they were only half protected. And we don't know which ones had already gotten the vaccine and which ones had. Now, they're also seeing some healthcare workers who've gotten vaccinated and then gotten COVID-19. Does that mean that the vaccine gave them COVID? No. It means that they were exposed to COVID, and when they went to get the vaccine, they probably already were harboring the vaccine, harboring the virus in their body, and then it became symptomatic, because it takes anywhere from 2 days to 14 days after you pick up the virus in your system to get symptoms. In that time, they got vaccinated, so, unfortunately, they developed COVID-19.
Okay. All right. So we also have from, we have to go back up because Valerie, we want to thank Valerie for coming in, but she has a few questions. Here we go. It seems like as soon as the vaccine, here we go. Seems like soon as the vaccine is distributed in some areas, the appointments fill up the same day. Is there a system or a formula for how many doses or how often jurisdictions get vaccinated?
So that's part of the problem. Great
Right.
question, Valerie. The federal government promised states initially, we're talking about back in November, a certain allocation of vaccine. When it came time to actually get their allocation of vaccine, it was way less than what they had been originally promised. We're talking about like, oh yeah, you're going to get 40,000 doses initially, but then come time for delivery, it was like 6,000 doses, right? So huge discrepancy. Then we just find out this past week that, there was supposed to be this stockpile of vaccines available for people to get the second dose. So they were saying, okay, so for those states that, you might not have had enough people signing up, you can go ahead and start to give those doses to elderly people and frontline workers. And we're going to send you, that second dose for the original people that got it. Well, it turns out that there was no second dose.
Yeah.
That whole story about the stockpile was made up. So the federal response to date has been lackluster, and the vaccine distribution is no exception to that. And it's put the states in somewhat of a bind when it comes to trying to allocate, the lower number of vaccines that they did actually get. Now, the systems, we were talking about that at the beginning of the show, the systems, to push the vaccine out within the state also need some help. They need to staff their call centers fully. They need to reserve appointments for the most vulnerable individuals in society, so that, people who are more well-resourced don't jump to the front of the line and get the vaccine first before the people that really need it.
Which is why we you shared some information with the producers, Dr. Mill, about the UK and universal healthcare, right? And it's so amazing that they have it because of uh, the haulers, right? And this isn't really about the vaccination, but more about the long haulers and the effect of COVID-19 on people who've had it over time. But if we had universal health care here, this is the producer, this is the the opinions of the producer are mine and not necessarily those of Dr. Melissa Clarke. Um, but if we had universal health care, um, that would be awesome for us. And so I just want you to speak to Dr. Mill what it means, what a long hauler is, and what some of the potential fallout is for people who are affected by COVID and are going to have it for a long time because it affects more than just their health.
Yeah. So, in the weekly recap, I talked about the fact that long COVID is no joke, and that, there are these thousands and thousands and thousands of people who are having COVID symptoms for, 6 weeks, 3 months, 9 months. And so my concern about the United States when it comes to the fact that we don't have universal health care is these people who are now have kidney disease and heart disease and lung disease and diabetes as a result of having COVID, if they don't have jobs because they've lost their job because they're in the restaurant industry or the hospitality industry or in entertainment, they don't have jobs, they don't have health insurance. What are they going to do? That's
Right.
one of the most compelling arguments, I think, for universal health care
Exactly.
in this society, because you can't have your healthcare linked to your job if people are losing jobs left and right. And now we have a whole new cadre of people who have this new disease and long-term effects from it that are going to need healthcare and are going to have a hard time potentially getting it.
Yeah.
Okay, we have another from Conchita Mays. Did Kaiser purchase a vast amount of the vaccine in the DC area?
Conchita, great question. Unfortunately, I don't know. You stumped me on that one.
Okay. All
Yeah.
right. Is another statement from Marv West. He's in Ohio. And I would like to say, he said, this week in Ohio, we start vaccinating people 80 and over, not in assisted living. Those we know in that category have had seamless experience registering and getting appointments.
That's great. And I'm glad Ohio is getting it straight. That's wonderful.
They have Governor Devine, who is, I think he has been on top of this whole pandemic
Divine. Mhm.
before the rest of his party. He is
Yeah.
Republican, and he is, and we're not calling out parties. We're only calling out the fact that people didn't do their jobs at all. That I'm
Or
calling out.
effectively.
I'm calling out they didn't do their jobs at all. That's a producer. The opinions of the producer are those of his, not exactly. Okay. So,
But to Marv's point, that he made a great point. I mentioned earlier, my aunt is in an assisted living and boarding care, and they have been really proactive about managing vaccinations for those residents and having the healthcare workers come out, take care of it. It's done.
so
Well,
we have a,
meanwhile in Maryland, we have yet to get to assisted livings. My mom is in
Really?
assisted living, and we signed the consent forms for her to get the vaccine and all that. And I just found out today that by Friday she'll have an appointment at some point.
okay.
But
Okay.
yeah.
Okay, we're in a lightning round here. We have 5 minutes. We're 5 minutes to go, and we have two questions. One from Wendy White Smoke. I like saying that name, Wendy White Smoke. Do you get the same dosage amounts in the first and second shot?
Yes, Wendy. Hi, Wendy. You do get the same dosage in the first and second shot.
Okay, second one. Do you have from Sheila Williams, also from Ohio? We know these things because we're producers. Do you have to get your second dose in a certain period of time? I know you need to wait before the second dose, but how long can you wait before you get your second dose before it doesn't work anymore?
Yeah. Don't have the answer to how long it is, but it's best to stick with the protocol. That was what was approved. That's what we know works. So again, for Pfizer, it's 3 weeks, give or take a couple days, probably not a big deal, but I wouldn't, push it out 6, 7, 8 weeks for sure. And then with Moderna, again, 4 weeks. And again, a couple days, probably not a big deal, but I wouldn't try to push the envelope.
Yeah. We can't treat it like antibiotics, y'all. Get your bottle and only take them until you feel better and throw the rest away. You can't do that.
And by the way, hi, Sheila Williams.
I have no
Great
comeback
question.
with that other than to say uh, it is Dr. King Day. I mean, it is a day of service. And so I want to thank you, Dr. Clarke, for being of service to us all, really, day in and day out. Uh, and trust me, to my friends who call you, day in and
Exactly.
day out. Uh, uh, you got it. Do you have any words, final words you want to wrap up with?
Well, thank you for mentioning that. I'm honored. I don't take this lightly. I'm honored by the trust that people have in me. I mentioned my mother. My mother marched with Dr. King, is very much about service, and she taught me that really to be a part of the human family, it's the rent that you pay to be a part of the human family. And so on today, this day of service, I honor Martin Luther King. I honor the fact that I have this platform and that I can use this platform to continue to be of service. You mentioned, we talked about health literacy. That's one of my big passions, to make sure that everyone gets the right information, so that they can use it to be health empowered. And that's why I use that slogan every week when I talk with you. And I'm going to continue to do this work until, as long as I can. So thank you to everybody who tuned in tonight. Thank you so much to my fantastic, fabulous producers, Wayne Bruce and Lila Mays. And
Oh, and if we have any Clubhouse listeners out there,
How many
just
people on
follow us.
Clubhouse? How
Yeah.
many people on Clubhouse? Get on
we,
Clubhouse
we
and
did our
join
Get
us.
first,
on Clubhouse. You can
we did
ask your
our first,
questions live.
yeah, we did our first Clubhouse last night. It was fun. We're going to be doing more. And, I'm on Russ Parr every Tuesday morning at 9:35 a.m. East Coast time. So tune in if you want to hear that. And otherwise, you can see me Monday night, 9 p.m., Facebook Live, YouTube Live. That's East Coast time, 6 p.m., West Coast time. Until I see you, remember to be wise, be well, and be health empowered.